everybody, my name is Travis Robbins.
And I'm Todd Robbins.
We're both physical therapists. We've been physical therapists for over 15 years, and we own Robbins Rehabilitation, which is a privately owned physical therapy company in the Lehigh Valley with 4 locations. And today we're excited to talk to you about keys for you to have a successful running and walking program this year. So some injury prevention stuff, some movement technique type stuff, all things that's going to help you have a successful running and walking season this year. Okay, so the first key to success in a running and walking program that we're going to teach you about today is foot position. Okay, so what I want everybody to do is you're just going to march in place, take a couple marches in place, and then put your feet down about shoulder width apart and pretend you're standing in line at the back. Okay? Now look down at your feet. Okay? So what you want to see is you want your toes as straight ahead as possible. A common compensation is for what, Todd? So for toes to kind of be turned out, right?
Yep, something we see a lot in our clinics, in just a standing posture, is for out-toeing, your toes turned out from midline or the center.
So the problem with that is if you're standing or doing anything, especially if you're running or walking, then when your foot hits the ground and your foot is out-toed, it doesn't set you up for success up the chain, right? So if my toe is turned out like this, what commonly happens is I'll get an overpronation, which means my foot kind of flattens out. If you've seen anybody with flat foot or if you've been diagnosed with a flat foot condition, your foot flattens out and then your knee has no other alternative but to come in like that. And you can kind of see this isn't really good alignment, although we see it with runners all the time. So the importance of getting the foot right straight ahead when you walk, stand, or run is that it kind of sets you up for success further up the chain. So if your toe is right straight ahead when you hit the ground, then it's really hard for your knee to kind of dive in like that. You can do it, but if you want to try to think of something really simple to set you up for success, running, walking, standing, doing anything, toes right straight ahead. The next key to a successful running and walking program is achieving normal ankle dorsiflexion. So that's just a big word for your ability to bring your toes up to your nose. Okay? So there's a certain amount of range of motion that's necessary in order for your foot to have success when you run or walk. Okay? So if Todd brings his foot up here, and if this is a 90-degree angle, you can kind of see that, what we've got to get Todd to is about 10 or 15 degrees past that. Okay? If he doesn't get that, then he'll make compensations in the way that he moves when he walks or runs, and typically they're not good compensations. So what will happen is if I'm walking or running and I go to put my foot down here and then I go to transition through, anything with my right leg coming through here, if I don't get that normal dorsiflexion, the ability to bring my toe up like that, then the number one compensation is that you'll overpronate, so flatten out your foot, which isn't good because that will kind of stretch out all the structures on the inside of your ankle and your knee, and it's not again setting you up for success. So what we need to do with this is a simple exercise that you can do, and one that if you're an avid walker or runner, probably one you've done a bunch of times, is just a straightforward standing gastroc stretch. Okay, so from here, the back foot, the knee is absolutely straight, and the foot is right straight ahead. Okay, and you're just coming forward so you feel a pull in the back of the leg there. Okay, so you should feel a pull in the calf there. Stretches, we want sustained stretches, so holding for 2 minutes at a time. Doing a couple of those will help, a couple times a day will help lengthen out that calf. The other reason why you don't get normal dorsiflexion, could be a calf tightness issue that will restrict that motion, but also could be an ankle issue. Okay, so if there's a loss in ankle mobility there, if the talus and the calcaneus don't communicate very well, if they're a little bit stuck, then that will kind of restrict range of motion there, and that might require a mobilization if you go to a physical therapist or come in to see one of our physical therapists, and it would be a pretty common mobilization to do just a distraction technique and then increasing dorsiflexion range of motion there. So typically 2 components, lack of ankle range of motion, so a hypomobility in the ankle, or a length issue in the calf will restrict that range of motion. If you address those 2 things, you achieve normal dorsiflexion, again, you'll be set up for better success up the chain when you do your running and walking program. Another key to a successful running and walking program is to avoid a medial knee dive. So what does that mean? It kind of relates to some of the other things that we talked about with your foot and ankle, but if you run or walk and when your foot comes down, if your knee kind of dives inside your foot, that's something that you want to try to avoid, okay? If you were to look down when you're doing your walking run program and your heel hits the ground, you want your knee to be over the middle of your foot or maybe even a little bit to the outside of that foot. So when Todd takes a step forward, if his knee dives in like that, then you can see he's not really set up for success here. what will happen here? He'll tend to wear out the outside of the meniscus here. He'll tend to stretch the medial structures on the inside of the knee, so he might have some medial knee pain, some lateral knee pain. He might have some hip pain because the alignment there is thrown off. He might have some low back pain. So all of those problems kind of related to the fact if you can't keep your foot forward and your foot over pronates and your knee kind of dives in like that, all of those things will set you up for an injury, which is going to slow you down in your walking and running season. So we definitely want to try to avoid that. Another key to a successful running and walking program is the ability to get into a full squat. So you might think, well, why do I have to get into a full squat? I don't really get into a full squat very much when I run, and you shouldn't. But it's really important for overall joint health and range of motion. So what we're going to do is we're going to have Todd get into a full squat right here. Okay? So remember the keys that we talked about earlier. So you want your toes right straight ahead. Okay, so Todd's toes are turned out a little bit, and that's a common compensation. So if that's happening, then turn your toes out, or turn them back in. Okay? Another key is to keep your heels on the ground. Commonly, what happens is when you get into a full squat, you might come up onto your heels a little bit in order to keep your balance, okay? We don't want to do that. We want to keep your heels on the ground, so that promotes normal dorsiflexion like we talked about. Okay? Another common compensation would be you might have your knees kind of dive in a little bit when you do a full squat. Okay? So you want to try to keep your knees over the outside of your feet, again, promoting that lateral knee position. Okay? And come on up again, Todd. Okay? So this might not make a ton of sense on its surface if you're a runner or walker. Well, why should I have to do that? But think of it like this. If we all went and we took our car and we parked it in a garage and we left it there for 10 years and then came back and tried to turn it on, it probably wouldn't run very well. Even if it turned on, it wouldn't run very well. If your knees, your hips, your back, your ankle are not going through a full range of motion, they're not going to run very well when you get them into that full range of motion. So if you can't assume a full squat, you're not moving properly. And proper movement it's pretty easy to make the relation that proper movement is really important for running, and it's really important for injury prevention. So spending, working on it a couple minutes, at the beginning, using some assistance. If you can't get down into a full squat by yourself, using the edge of a table or a chair for some balance is fine, but a progression would be you want to try to get down into a full squat somewhere between 2, 5, 10 minutes during the day, and that's going to be really important for injury prevention and overall range of motion and joint health. Another key to a successful walking and running program is to not walk or run if you have pain. So what do you think when you hear that?
Yeah, so, pain is a message that your body is telling you that something is not working properly. But very classically with a lot of runners we see in the clinic, they go, well, I'm going to kind of run through it. Sometimes you can tolerate that for a while, but eventually you'll get larger breakdowns over time.
And so ideally for us, if we're going to see you in physical therapy, we want to get you as close to the start of the injury as possible, which is fairly uncommon for runners, right? So runners and walkers, they kind of push themselves through it, like Todd said. But when we get our runners and walkers in the clinic, part of our history, we say, well, when did this problem start? They'll typically say, about 6 months ago. Very rarely do we get someone that says it happened last week. And the difference between getting to a problem when 6 months have gone by as compared to 1 week have gone by is huge. It's a huge difference on every level, because if you let it go that long, then we have to clean up the compensations that you've made around that pain. So let's take something very commonly we see in our clinic, lateral knee pain. Patient comes in, they've had it for 6 months. Well, now they have some kind of pelvic problem, they have a foot and ankle problem, they have problems all over, a lumbar problem, because they made compensations around the lateral knee pain that would have taken us maybe a couple visits to clean up by looking at mobility of joints, muscle weaknesses, pretty straightforward thing that we could have cleaned up if we had it right in the beginning. But now that all the compensations have been made, it takes us longer to fix that problem.
So as soon as you have the pain, pay attention to it and get it addressed before it becomes a large problem.
Okay, another key to a successful walking and running program is how you warm up and cool down before and after your walk or your run. There's lots of different dynamic warm-up tools you can use. We're going to show you 3 really easy ones that are pretty simple to do. So Todd's going to back up. The first one he's going to do is a walking lunge. Okay, so he's just going to take a great big step and getting his hips, his knees, and ankles through full range of motion and getting blood flowing to those joints and muscles that are controlling that. The next one he's going to do is just a high knee walk. So he's just going to kind of raise his knee up and then take a step forward. Again, getting that hip up into flexion, getting through his full range of motion. And last one we'll do is just a lateral walk. So it's kind of to the side here. Again, working on ankle, knee, hip, and lumbar spine range of motion. So that's something you want to do for a couple minutes before you start your walking and running program. That wraps up our video on keys to success for a running and walking program. I want to leave you with a couple things. If you are having pain with your running and walking program, again, we want you to try to address that as soon as possible. If you're in the Lehigh Valley, you can come see us. We have 4 locations: Allentown, Bethlehem, Nazareth, and Phillipsburg. We have a 24-hour policy, so if you call us up, you will get in within 24 hours, and we can help you start fixing your problem right away.
Yeah, and really importantly, you do not need a script from a doctor for physical therapy in Pennsylvania or New Jersey. You can just call our office, or both direct access states, so we can get you seen right away and start working on that problem.
All right, guys, thanks for your time today. We hope you enjoyed the video. We hope you get something out of it, and enjoy your running and walking program this year.